moving on to healthcare, speaking of embarrassing and speaking about healthcare, I'm absolutely at this point ready to say that what's happening with healthcare is if it's not yet, it is a complete embarrassment. And what I mean is this. With 60 votes in the Senate that the Democrats have, and this is not a criticism of the conservatives, this is a criticism of the so-called liberals who are not even mentioning the possibility of a single-payer plan and are begging, pretty please, can't we just put in some washed, watered-down version of a public option? Absolutely pathetic. With 60 votes in the Senate, it will be an embarrassment if no public option gets through. It will literally just be embarrassing. This is the way it's looking right now. Bill Clinton said it won't be as bad as what happened to he and Hillary Clinton in 1994. I believe that it would be far worse because the Democrats did not have 60 senators. They didn't have 60 votes in 1994. Now they do. If they still can't get this done with 60 votes in the Senate, it doesn't matter what is said. It will be an embarrassing disaster. No matter what conservative news outlets try to tell you, not only do they have 60 votes in the Senate, they have the support of the American people. Yes, you can find biased, skewed, leading question polls that don't make it completely clear that a public option, as long as it doesn't replace by necessity the private plan that you have, should be included. Just last week, we said it's easier to find people who believe in UFOs than it is to find people who are opposed to the public option. On what planet would the Democrats be able to get anything through? Forget about single payer. Forget about even a reasonable public option. Just like this watered down piece of crap public option that it seems like is going to be the only option that's left is what would get through. On what planet could you get something through if you can under these circumstances, if you're the Democrats? Overwhelming public support, if you look at the legitimate polls, and 60 votes in the Senate, and an increasingly costly, horrible healthcare disaster.
Right. And yeah, I agree. It's embarrassing for the Democrats and for the administration, but it's much worse for the American people and for our economy. And unfortunately, I think, well, perhaps once this public option eventually becomes available and, turns out to work rather well, maybe
Which,
then...
by the way, in the best case scenario, if it passes, we know it'll be a fraction of what it originally was. It wouldn't even become effective until 2012, maybe even 2014 in some cases. We're not talking about anything good happening soon, by any means.
Right. Which I predicted. But...
Well, yeah. And speaking of embarrassing on this term of healthcare, Montana Senator Max Baucus, we hear a lot about him. He's the Senate Finance Committee chairman, the Senate's point man on healthcare reform. A new article in the Montana Standard finds that Senator Baucus has received more campaign money from health and insurance industry interests than any other member of Congress. So we know that many members of Congress receive money and are paid in campaign contributions from some of these companies. The point person on healthcare in the United States, Max Baucus, is the guy who has received the most money from those same companies and industries that have the biggest interest in preventing reform.
Ultimately, we really don't know what's going on behind the scenes in terms of money and donations and bribes and all that. I mean, we talked about how powerful the insurance companies are. It may never happen just because of that.
Well, the article said in the past 6 years, nearly 1/4 of every dime raised by Baucus and his political action committee has come from groups and individuals associated with drug companies, insurers, hospitals, so on and so forth. So I actually looked into this. There's many websites which will show you the specific contributions of different companies and industries. The top contributors to Max Baucus over the years have been AIG, Aetna, and New York Life Insurance, 3 big contributors, insurance companies with all sorts of different types of insurance. The top industries that have provided money to Max Baucus's campaigns: insurance, pharmaceuticals, health products, health professionals. Incredible. There's no question that these are large donors to many senators. So I'm anticipating emails saying, look at who donates to any senator. I get that. But the point is, not only is he the point man for healthcare, he is also the guy who has received the most from these companies. It's incredible to me. It really is incredible. John Ensign, who's also in the Senate Finance Committee, if you think that other than Max Baucus, we're in good shape with the Senate Finance Committee, here's a news alert. We're not. We're not in good shape. In the Senate Finance Committee, there have been a number of amazing statements, including from Republican Senator from Nevada, John Ensign. He tried to make the case, and I'm warning you, Lewis, it's going to take getting back down to a lower level of intellect and understanding, even than from where we're at, which is already we're operating at a mediocre level to say the most. Ensign tried to argue that the U.S. system is the best in the world, and he bristled at data that the country lags in halting preventable deaths compared to other industrialized nations. He argued that the comparisons are unfair, and here's why. They include deaths from auto accidents, and we know the U.S. has a lot of cars, and gun violence, which are unique cultural factors. And he goes on, if you think just that general statement is a little bit funky, this is what he literally said. When you take into account cultural factors, the fact that we drive cars a lot more than any other country, and we're much more mobile. If you take out accidental deaths due to car accidents, and you take out gun deaths, because we like our guns in the U.S., you take out those two things, you adjust those, and we actually are better in terms of survival rates. It's incredible. What he's saying is he's proud of these cultural factors. He's proud. He's okay with having a ton of car accident deaths because, hey, we really like our cars and we really like to be mobile in the U.S. And he says it's okay that guns kill thousands of people because we like our guns. That's essentially what he's saying.
That's great. We can skew and alter statistics in any argument anytime we're talking about numbers.
It's like if I said to you, listen, Lewis, you're for the AIDS in Africa lobby. Okay, you know what? If you take out the fact that so many people in Africa die of AIDS because, well, come on, we don't have the money to treat them all. AIDS isn't really that big of an issue in Africa. We just have to take out all the people that we just don't have the money to treat. They don't really count to the death pool.
Exactly.
Who would allow something like that to be said in the Senate Finance Committee and not be
taken seriously
and be taken seriously in any way? And you know what? Let's say we do what John Ensign is saying, and we remove those two crucial parts of deaths in the U.S., car accidents and gun deaths. The U.S. is still only 17th in avoiding preventable death. Still not great. Still not great. I don't know any other areas where people in the U.S. would accept being 17th.
No, not good. Certainly not the best.
And lastly, if you need even more evidence that there's reason to be concerned about the Senate Finance Committee, which at this point we don't, that's making so many decisions about healthcare reform, here's one. This is the same committee that voted for $50 million for abstinence-only education. Orrin Hatch said, it works, even though Congress's own research, the research that his employer has done, is just plain old common sense show you that abstinence-only education does not work. And I won't even insult our audience by boring them with the obvious statistics about it. It's incredible. The Senate Finance Committee, to me, just seems it's troubling. It's troubling to me, the Senate Finance Committee, and it's scary to me that they and Max Baucus are in charge of reforming healthcare for the U.S.
Well, I don't know what to say about it. It's odd.